know that the recording is getting up and running on Facebook, so we're just going to take another minute to make sure that people who want to take advantage of this opportunity to come together can do that. In the meantime, I recommend just giving yourself permission to be in this space. It's going to be a 30-minute call together. It's not a very long time, but it'll be impactful. And the reason why this is impactful is because coming together to collectively mourn is an important part of the grieving process. And it's a part of the grieving process that so many of us have been robbed of, given the nature of this virus, and our traditional tools for grief and mourning have been either downsized or completely inaccessible. To date, we have lost over 210,000 individuals to the coronavirus in the United States. Over 7.5 million people have fallen ill and recovered. That is a profound impact on our communities, in our lives, and in our families, and in our hearts. To date, there has been no acknowledgement of the loss. And what we are doing in our week of mourning is really pushing back on that in the radical act of mourning out loud, mourning together, and really allowing ourselves permission to feel how we feel right here in this moment about our own losses and the losses of our greater community. I know I, for one, have been having a really hard week, and I can imagine many of you are as well, on top of a really, really hard year. So I just want to say thank you for carving out this time to be together. And I look forward to being together with you over the course of this next 25 minutes or so. Couple of other pieces before I introduce our guest today, Fiona Tulip, is just a bit on Marked by COVID. Marked by COVID is a nonprofit that I co-founded with my partner, Christine, and the help of friends shortly after my dad, Mark, tragically died from COVID-19. Our mission is to help uplift stories of loss, other ways that people have been impacted in order to save lives, and also to help hold elected officials accountable for their pandemic response. We have had an enormous amount of folks come towards us, at us with a bounty of tragic stories. One of the ideas behind the week of mourning really came from my own reaction to the 9/11 ceremonies this year, which was just a few weeks back. On September 11th, every single year we have a day of remembrance. 2,777 people died in that tragedy. And we are, as a society and specifically as a culture, very used to tragedy striking suddenly, whether it's two airplanes crashing into the Twin Towers or a lone gunman entering into an elementary school and killing 26 people, including 20 kindergartners. These events happen suddenly, tragically, and arrest the attention of the public, politicians, and people around the world. In each of those instances, we acknowledged the tragedy. We did not downplay the tragedy. We honored those who were lost. And in the instance of September 11th, we vowed as a country to never forget. On that last note of never forgetting, the week of mourning is our opportunity to start committing to one another that we will never forget. We will never forget the loved ones that we have lost. We will never forget the response that got us here. And in never forgetting, we will commit to never allow this to happen again. Recognition is key to that. It's key to healing. It's also key to ensuring that our children, our grandchildren, and future generations knows exactly what got us here and exactly the cost of those decisions. So thank you so much for joining me here today and joining us together over the course of this week. This has been, again, a very hard week for me, but I've been looking forward to these moments to just be with my emotions and know that I am amongst friends. So without further ado, I'd like to welcome my friend and sibling in grief, Fiona Tulip. I will share that Fiona was probably one of the most instrumental strangers in helping to make Marked by COVID what it is today. Shortly after my dad passed, Fiona reached out to me, sharing with me that her mom had passed. She'll share more about her story in a moment, but without Fiona reaching out to me in the way that she did, I don't know if I would have had the courage to continue to do what I'm doing. So it is with an abundant amount of gratitude that I get to work alongside you, Fiona, and you and your mom's story continue to inspire me every single day. So thank you so much for your bravery, for sharing your love and your beautiful mother with me and the world. And it is an honor to be working alongside you in this work. So Fiona, the floor is yours.
Thank you so much, Kristen. And I feel the exact same about you. It is truly an honor to be working alongside you and others who have lost loved ones and uplifting everyone's story. My heart is with all of us who have lost someone, a friend, a loved one. This is a tough time, and I'm just grateful to have the opportunity to bring us together and to honor our loved ones that we've lost. So I will tell you a little bit about my mom's story, and then I'll talk about who she was and what she meant to me. My mom died on July 4th from COVID. That was one of her favorite holidays, and one of mine too. She was very proud to be an American. But right now, I don't feel so proud, and I'm not sure she did either. On my daughter's first birthday this past year, my daughter didn't receive a call or a card from my mom. Instead, we lit a candle in her honor as we settled in for the night, spending the day without my mom's love. My 64-year-old mother, Isabel Papademetrio, was a respiratory therapist at Baylor Scott and White Rehab in Dallas, Texas. She was supposed to be visiting us in Brooklyn in June, but we canceled that trip because we thought it was too risky to get on a flight, to come here, be with our baby. We didn't want to put anybody at risk. So she stayed home and she picked up extra shifts at work because she wanted to support me and my husband, whose jobs have been impacted by COVID. I didn't know about this until after she died. And it was during those extra shifts that she helped with the spike in cases of coronavirus. The hospital where she worked was at capacity, so her rehab unit started taking on COVID cases. However, there were some people in the rehab unit she didn't know had COVID. They also didn't have enough PPE to protect them. My mom had to use the same surgical mask for 2 weeks. She would be given it at the start of the day by her manager, and then she would have to turn it in at the end of the day. And she told me about how some of her colleagues hid their PPE because they didn't want to give it back. They wanted to be protected and they wanted to feel safe. During a time at work when she was taking care of an elderly man, a patient of hers, the man's daughter was visiting, and she refused to wear a mask. My mom asked her to wear a mask, and she said, "If my president doesn't wear a mask, why should I?" And that's when my mom knew she was in danger. Shortly thereafter, many patients and many healthcare workers caught COVID. My mom came home on Saturday, June 27th, feeling sick. And so for 2 days, she looked for an available testing site to get tested. She was worried she had COVID. On that second day at night, she found out she was COVID positive, and she didn't tell me. I had no idea. She spent that week taking a note of her symptoms in a journal. She would write down her fever. She would talk about how she slept. She would turn her body into certain positions as she slept so she could breathe easier. All the while, I still didn't know. My family was urging her to go to the hospital, and she said, "You don't understand. It's worse there." Because she knew what it was like at the hospital. She knew they were overwhelmed. She knew she might not get the best care, and she was worried she would die there. Finally, my brother sent me a text in the middle of the week, and he said, "Mom's feeling better. I just wanted you to know." And I had no idea what he was talking about. And then he called me and told me she had COVID. I texted her and I asked her what the situation was, and she said, "I'm going to fight this thing for Princess Lua. Lua is my daughter and her one and only grandchild and her one and only pride and joy. She replaced me." I believed her because I knew how much she loved Lua, and I knew she wouldn't leave this earth because she needed more time with Lua. After that, Thursday and Friday, I texted her to make sure she was okay. I didn't call her because she said she was too tired. It was hard to talk. And then on Saturday morning, the morning of July 4th, I received a call from my brother, and he was frantic, and he said, "I'm so sorry. I'm so sorry." And I crumbled to the floor because I knew. My mom that morning texted my brother saying, "I can't breathe, I need help." He called an ambulance even though she told him not to because it was too expensive. And as soon as they put her on the gurney, she lost her pulse. By the time she reached the hospital, she had lost her pulse 3 times, and the doctors said that she might have suffered brain trauma, and if they brought her back, she would likely be in a vegetative state. It was so fast. She started feeling symptoms on a Saturday, and she was gone the Saturday after that. I spent that day feeling so devastated and sad and wondering how to bring her back. I thought maybe if I jump through this window, I can bring her back. She's not supposed to be gone, and I know that. And so I became angry because I realized I couldn't bring her back, and I realized that her death was preventable. And that's when I reached out to Kristen because I wanted to speak up, and I wanted to do something to change this America that we're living in, to change the America I was once proud of, to change the America my mom once loved. July 4th will never be the same for me again. It will always remind me of the Trump administration's resistance to fight this thing, resistance to protect my mother, their resistance rooted in liberty. And it will always remind me of how their actions clashed with my mom's unalienable right to life. She was a hero, and she was brave. Our healthcare workers are heroes, and they are bravely walking through those hospital doors to save our lives. So I hope that everyone keeps that in mind, and that when we are out there, that we're remembering the healthcare workers who are putting their lives on the line, and they don't want to. They don't want to be a hero. They want to see their granddaughter turn 1. They want to see their granddaughter take her first steps. They should never be in this position. So please remember them. Please honor them. And please remember those families and those friends who have lost a hero in their life are hurting. And so I'm thankful for Kristen and Mark by COVID and for everyone who's joined today, because we need to unite to win this war against COVID. We need to support each other, and we need to support those on the front lines. Thank you.
Thank you so much, Fiona. Such a powerful story. And though I've heard it a couple of times before, it continues to touch me because your mother did not deserve to die, and neither did the more than 210,000 people that we have lost. We are now going to recognize a few of the folks who are healthcare workers that have been lost too soon. And we have a slideshow with a few of their names, ages, and occupations. And so I first would like to recognize Sean Boynes. He was a pharmacist, lived in the Washington metropolitan area. He died at 46 years young. We remember Sean Boynes. Celia Yap Banago was a registered nurse. She was from Missouri and passed at 69 years young. We remember and honor and mourn the loss of Celia. Fiona's mom, Isabel Papadimitriou. She was a respiratory technician in Texas. We lost her at 64 years young. We will never forget Isabel. We are here to mourn the loss of Isabel. Felicimo Tom Luna was an emergency room nurse. He passed in New Jersey. He was 62 years young. We will never forget Tom. Karen Carmelo, registered nurse. She was in New York City and passed away at 57 years young, being on the front line of the original spike in the United States. We will never forget Karen Carmelo. Jerry Alford, also a registered nurse in Alabama, who passed at 60 years young. We mourn the loss of Jerry. We will never forget Jerry. Carla Dominguez, she was also a registered nurse in Texas. We lost her at 33 years young. We will never forget Carla Dominguez. We mourn her untimely loss. Maurice Dotson, he was a nursing assistant, also in Texas, who we lost at the young age of 51 years because of this virus. Maurice, we grieve your loss. We will never forget you. I'd like to invite everyone to join together in a minute of silence. Thank you. Before we wrap up our program today, I did also want to say two things. One, this is just one vehicle for participation for Mourning Out Loud. Please join us again tomorrow and the next day, but also please participate in other ways. There are ideas online on our website, weekofmourning.com, for either hosting your own event or joining something else. Tomorrow's vigil is actually, sorry, I forgot to update this, mourning folks who lived and worked behind bars. On social media, be sure to tag Empty Chair. If you're doing an empty chair action, Week of Mourning, marked by COVID, and Mourn Out Loud. And finally, before we go to the song today, I wanted to just take a moment to think about, again, the incredible burden being put upon our healthcare workers right now. And think about the people who are still with us. We just observed 1 minute of silence. In the course of that 1 minute, 4 people died in the United States, died from COVID. Over the course of this call, this 30-minute call, 120 people will die from COVID. This is not over. People are continuing to die, and it is up to us to stand firm and fight for the living. Thank you so much for joining us today, and we will leave you with a song to reflect upon. This song is of particular importance to me because when my dad died, I had the opportunity to not be with him, but prior to his passing, I had several FaceTime conversations with him. If you have a loved one in the ICU, a FaceTime or visual conversation is one-sided while you see your loved one on the other side. I wanted to try and bring to my dad some semblance of peace, love, and music, something that he loved so desperately, and something that I loved, which I got from my dad. So this song that we will play for you is the last song that my dad heard.
Peace train sounding loud, glide on the peace train. Biseka, come on, peace train. Peace train on its way.
I've been happy lately, thinking about the good things to come, and I believe it could be, someday it's going to come. Oh, I've been smiling lately, dreaming about the world as one, and I believe it could be, someday it's going to come. Someday it's going to come, come take me home again. Come on the peace train. Someday it's going to come. Come on the peace train. Take me home again. Oh, peace train sounding louder. Glide on the peace train. Come on the peace train. Cause out on the edge of darkness there rides a peace train. Oh, peace train, take this country, come take me home again. Oh, I've been smiling lately, thinking about the world as one, and I believe it could be, someday it's going to come. Someday it's going to come, come take me home again. Come the peace train. Someday it's going to come. Come on, peace train. Take me home again. Someday it's going to come. Someday it's going to come. Someday, someday, someday it's going to come. I've been crying lately, thinking about the world as it is. Why must we go on hating? Why can't we live in bliss? Peace train sounding louder, glide on the peace train. Come on, peace train. Someday it's going to come. Come take me home again. Come on, peace train. Someday it's going to come. Come on, peace train. Take me home again. Come take me home. Come take me home. Come take me home again. Someday it's going to come. Come take me home again. Come on, peace train.
Thank you for joining us here today. Thank you again, Fiona, so much for not just being here, just being with me all the time. And we'll see everybody tomorrow, same time. Thank you.